All right, so our lovely patient here has been numbing for the last 25, 30 minutes. Anytime you're doing anything with needles, you want to make sure that all of that numbing comes off and their skin is sterile. So I'm going to remove that numbing. This is actually an alcohol-soaked tissue. So we're going to remove all of that numbing. Once we get going with this treatment, and one of the things I love about this device is it actually moves quite quickly. You do have 3 different tip capabilities. 2 are your RF microneedling tips. 1 is a 23 needle tip, so it's very small. And then 1 is a 49, so it's much bigger. So just depending on where you're treating, what you're treating, will determine which of those you're going to use. But in this case, you know, for full face, I would just go with the 49. Now, RF microneedling kind of hit the market and it just blew up. And the reason it blew up is because it was great. And there were quite a lot of devices that came onto the market quite quickly. And I think what happened was they weren't so well thought through. What I love about this device is it kind of encompasses and covers all of the things that microneedling or RF microneedling, as well as, you know, non-ablative RF delivery covers. So we're actually going to do 2 different tips on her. In RF microneedling, you have insulated tips, you have non-insulated tips, and now we're seeing some of these zebra. So it's like some insulated, some non-insulated. The whole purpose of that is insulated tips mean that just the end of the needle is where the radio frequency comes out of. A non-insulated needle, once it's in, fires radio frequency everywhere, and that's spicy. It's already going to be spicy with needles going into the skin, right? But then imagine the whole length of the needle. So what they did with the CytoRF, what Image did with CytoRF, which is, I think, the coolest thing ever, is they came out with one of the only, I believe it's the only fractional non-ablative tips. So there's pins that come out, but they're dull. And what they do is they emit the heat in a manner that's painless, that would give that same comprehensive heat delivery that you would get with a non-insulated needle without the spiciness. And then you just have to go in one time with an insulated needle and deliver that heat deep. So you get all of that heat delivery and all of that, we call it saran wrapping of the skin, right, to give amazing collagen elastin induction and some tightening. So we're going to start off with what I love about this is a bunch of safety mechanisms to this device. One is that you can control your delivery with either your finger or a foot pedal. 2 is I love the way that this locks the tip on. So you just twist it like this, it comes right out. In this one, we are going to start with just the RF. You're never going to want to poke a hole do anything over where you've been injected or poked a hole. So our fractional non-ablative is going to happen first. So you're just going to line these back up. You're going to line these back up, push it in, and then it locks back up on its own. It did already interpret that we changed the tip. So it's defaulted to preset parameters, which I usually stick to. It has standby and ready, so when you are ready, and it also has face and body. Face and body are going to typically determine depth of penetration and parameters. In her case, we're doing face, and because there's no real depth with these, because they're not true needles, they're not penetrating the surface of the skin, they're just delivering heat, we're not going to worry about any of that. So I'm just going to hit ready. And each tip is good for 500 pulses. You will see a pulse count here. It will remember that on that pulse or on that tip. I'm going to use finger because I'm used to using finger. There's a lot of practices that prefer to use a foot pedal. If you do, we have that capability. So I'm going to start at the jawline. How you doing? Mm-hmm. You're going to do an overlap of about 10%. So you see it moves quite quickly. So we're going to do this full face, and then I will show you the RF microneedling. Now, if there is ever an area where it was either an area of concern for the patient, meaning deeper wrinkles, you can get as intense as you want to, within reason, of course. But if you wanted to do multiple passes over any given area, you're welcome to do that, and encouraged, quite honestly. A little bit of erythema and edema is normal with this treatment. Again, with this specifically, just the non-ablative, the fractional non-ablative. If, say, for instance, a patient wants tightening, but they are fearful of needles, this is an opportunity to provide them with the treatment, provide them with great results, but cater to the fact that they're afraid of needles. If, for instance, a patient comes in again and wants tightening, but maybe they have something to do in the next couple of days that would impede from being able to do the RF or the microneedling, then we could certainly, do that, do this treatment. So it's basically a dual modality device. Okay, so that was nice and quick and easy. We are now done with the fractional non-ablative, and now we're going to move into the RF microneedling. So we're going to go to standby. We're going to remove this tip, and we are going to, for the sake of time, now, I don't know if you can see very closely, but the same size of the 49 needle fractional non-ablative is the same size as the 49 microneedling, but there is a much smaller tip. So say, for instance, they were coming in and you were just concentrating on small areas, whether it be perioral lines or under the eye. I would definitely use the 23 just because it's much smaller. But in this case, we're doing full face. If you're doing full face and neck, if you're doing on the body with, stretch marks or some laxity on the knees or the back of the arm, something to that effect, I would definitely use the larger, the 49 needle tip. So you see the system did recognize that we removed the tip and is prompting me to add one. I shouldn't have to say this, but I'm going to say it anyway. You don't reuse tips. So don't reuse tips. There we go. Okay. Quick, easy to switch out of needles. Again, what I love about this system is, and the challenge that you find, or the pain points that we're seeing now, especially with consumer understanding. Social media has done some good and some bad for this space, and a lot of what it is patient misinformation. Because this modality kind of like hit the industry and hit the world because it was so amazing, RF microneedling, there were some devices out there and some sales rep out there that, were like, no pain, no gain, because it is painful, right? So you're just gonna have to deal with it. However, they were also like as aggressive as possible. Some of these guys go 6 millimeters into the tissue. Why would you ever go 6 millimeters into the tissue in the face? But because these reps were coming in and the technicians were listening to the reps rather than, the clinical trainers, they were going 6 millimeters into the tissue and basically causing fat loss, right? Nobody wants fat loss in their cheeks because now they have to go and get fillers. What I love about this system is on the face, you're only able to go 1.2 millimeters. And truly, if you're doing skin tightening, unless you're on an ethnic patient that has really thick skin, you're not going to need to go deeper than 1.2 millimeters. But if you do have an ethnic patient, or say, for instance, somebody comes in and they have some mental volume that they want removed in their below their chin, we can go to body. Hang on. You can go to body, and body will allow you to go to 3.5 millimeters. Again, there's no reason to go beyond 3.5 millimeters, even on areas of the body where our skin is much thicker. So we're going to stick to the face because that's where we're going. And we're gonna, again, stick to, I'm gonna go, when I treat on the forehead, I like to stay somewhere between 0.2 and 0.5. We'll provide a chart for you guys to kind of reference. Again, this is going to be based on the thickness of the skin of the patient, a lot of times their age and their ethnicity. So for her forehead, and I will adjust as we go throughout her skin, I'm actually going to take it to 0.5, and I am going to start. You okay?
Mm-hmm.
Some might argue with me in that your clinical endpoint with RF microneedling is the same as with microneedling. Because we're not intentionally doing, at the time of the insertion of the needle, transdermal delivery like you are with microneedling, because really the radio frequency would fry whatever that topical is. You will do it afterwards, and you'll see we'll use our stem facial matrix on her, which she will take the remainder of the vial home and use that to help heal and rejuvenate her skin quicker. And again, some might argue with me, your clinical endpoint with RF microneedling doesn't necessarily need to have pinpoint bleeding. You do just want overall uniformity in erythema and edema, because really it's the heat doing the work, right? You will get that transdermal capability. We will use the amazing stem facial matrix, but I don't need to see her all bloodied up when she walks out. Okay, now we're going to go back into standby. You cannot change any of the parameters on here unless you're in standby. So we're gonna go do lower face. I'll come back to her eyes and her mouth, but we're gonna do lower face. So I'm going to increase this to 0.8. You can usually do somewhere between 0.7 and 1.2 millimeters. I'm gonna see where we're at with 0.8, and we'll start back here at the jawline. You do want to make sure that your applicator is perpendicular to the skin. You want those needles to go in at a 90-degree angle, and you want the same depth across the board. How are you doing?
Mm-hmm.
My suggestion too is, if a patient's going to come in and they're going to pay for this treatment, and you're going to have to absorb the cost of the tips. Our tips are much more cost effective than the competition, but you might as well just promote to your patient, listen, if you're going to do this, let's do full face, neck, and décolleté. It's going to cost them a little bit more, but they're going to get more out of it. All right, we're going to go back down to 0.5. We're just going to do a quick around the mouth and one quick pass underneath the eye. I think it's important, but nobody really talks about grounding yourself on your patient. So touching your patient somewhere other than just with the applicator, it develops a level of trust with your patient that's kind of unspoken. As far as the under eye goes, because we are at 0.5, you're going to want to pull this tissue down and try to get into those areas where they have those fine lines. All right, after the treatment, patient is going to be feeling, that's it. Patient is going to be feeling warm, sometimes hot. I've seen patients run out and go start the AC in their car and just sit there in front of the AC in their car. That's normal. If this was something like plasma, for instance, a lot of times with plasma, you don't want to impact the inflammatory response. She's going to have it anyway with this anyway. She's going to get that heat anyway. So if she did want to put, say, ice on there or anything like that, it's not really going to impact the overall treatment and the results. Okay, so you see me using, this is our stem facial matrix. It comes in a roller, which I love, so you don't have any wasted product. This is chock full of cytokine growth factors. So those are your little healers and rejuvenators of the skin. They occur naturally in your own body. These are not plant derived. These are actually human derived. One derivative replicated in a lab that's FDA governed. There is no DNA or RNA in this. There is nothing autologous in this at all. It also has a whole bunch of peptides. So we see that patients recover and have far less downtime with stem facial than with any other post-care treatment. As I mentioned, I'm going to do this for her now. She is getting that transdermal delivery. We did create little microchannels in her skin. So this is going to be sucked in. And the beauty of this is it's water-based and the skin wants it. So it pulls it in. And because there is that injury, these little cytokine growth factors are going to go in there and heal her up. But I'm going to send this home with her. And she is, anytime she's dry or she's feeling itchy or anything like that, she's just going to bust this little guy out and rub it all over her face. I tell the patients, take this home and use it till it's gone. After you're done washing, before you put anything else on your face, just put this on. And then if you want to keep it with you throughout the day, I urge you to do that as well. Then they will take a duo home with them. The duo is their true post-care, and the duo, if they use half a pump morning and night of the 1 and 2. So 1 is actually the same thing as your stem facial matrix, except that it has 1 additional peptide in it. So again, this is like all these good things going home to help you heal, but also to maintain your treatment. Patients go back and they start using their old skincare regimen that doesn't have all these good things in it, and they're not going to get as good of a result. So 1 is the same thing as the matrix, and then 2 of the duo is actually oil-based. So it's going to create a barrier on the skin. Again, lots of good things in there, and we'll go over that in more detail, but this is just something to ensure you as the practitioner to know that this patient is going to go home and they're going to have the post-care necessary without you having to do it yourself.